Hi, I'm Dr. Sue Mitchell. I'm a board-certified gastroenterologist and I practice functional medicine. By really understanding your symptoms, I'm able to make a diagnosis, and more importantly, I'm able to figure out what part of your GI tract may not be working right, and then it helps me dive into the root cause and be able to help you to heal. So when patients come in, I will always want to know, how do you define constipation? So constipation can mean a lot of different things to different patients. Sometimes patients will feel constipated because they're not going very often. They may think they're only going every 3 days, and that may feel constipated to them. They just suddenly have noticed they don't have the urge as often. Sometimes constipation can mean that they feel the stool in the rectum, but they can't push it out. So they may describe that they're straining, they're spending prolonged amounts of time on the toilet. If you feel like stool's in the rectum and you can't push it out, I will always want to know if you feel that it won't come out because it's very hard, or sometimes patients will have very soft stool and they can't push it out. They'll feel like this should come out, but I'm straining and I can't get that stool to come out. So depending on your symptoms, I may recommend that I do a rectal exam, because you can tell a lot on a rectal exam. I can tell if the pelvic floor is weak, I can tell if the anal sphincter is relaxing when it should, and you can also tell that if the anal sphincter is really tight, tighter than it should be, because that will really help in terms of figuring out the cause behind the constipation. Now, diarrhea is an important symptom too. So if you come in complaining of diarrhea, I oftentimes will want to know, how many bowel movements are you having a day? Are you having them at night, or is it just during the day? What does it look like? Is it really watery? Is it explosive? Do you feel like you see undigested food? Maybe you see some fiber material from the night before. You may see lettuce, you might see tomatoes. That's important. I also will want to know if you ever have any incontinence. That means that suddenly you had urgency to go, but you didn't make it in time. Urgency is a really important symptom too. So you want to be able to describe how urgent is it? How much time do you have to get to the bathroom? What does the stool look like in the toilet? Is there blood? Again, look for undigested food. Always want to know the color. Is it brown? Is it orange? Can it be a gold color? That can sometimes tell me whether or not there's extra bile in the stool. And then also whether or not you might see the stool may look oily to you. And that means, do you see fat droplets mixed in with the water? And that's an important part of the history of diarrhea as well. So these symptoms are really important to get more of a history behind them, because that really helps me figure out what may be causing your symptoms.